My name's Saurabh Gupta. I'm a gastroenterologist and interventional endoscopist, and I practice here at the Sydney Adventist Hospital and at Concord Hospital. So the endoscopic sleeve gastroplasty is an exciting new innovation which is basically allowing for non-surgical management for overweight and obese patients to assist them to lose weight. It's done purely endoscopically, just like a gastroscopy or an examination which we do under an anaesthetic to look for reflux and ulcers and those kind of things. And we can actually use a special new device and tool to stitch the stomach, so we reduce the stomach's volume to allow patients to lose weight by a multitude of mechanisms. We recently got accreditation to do it here at the Sydney Adventist Hospital, and we've performed this on the first 3 patients just a few weeks ago. The results have been fantastic. Patients have lost in excess of 9 to 10 kilograms in 3 weeks, and they're super excited about it. And we had some proctors coming from overseas. We had an expert from the Mayo Clinic in the United States, Dr Christopher Gostout, who is one of the pioneering team who's developed this procedure and has developed these instruments. And so he came along with the team to help us do the procedure and perform it successfully. So the benefits of ESG versus the traditional weight loss surgeries are multiple. Firstly, access and take-up of bariatric surgery has been very, very low. Even though there are a lot of bariatric surgery procedures being performed, only 1% of those people who actually fit the criteria for bariatric surgery are actually having the surgery done. Multiple reasons for that. People don't want an operation, the recovery time's long, there's potential risks of complications, there's a stigma associated to having an operation for weight loss, a lot of things. So this endoscopic procedure is a game changer for them. They can have a simple endoscopy which takes an hour to an hour and a half to do, under a sedation, just like we do normal colonoscopies, where the patient comes in, they're admitted overnight after the operation, mainly because they get some nausea following the procedure. Pain is minimal and other complications are negligible. So they admitted overnight, they go home the following day, they're on a modified diet, just like patients are post an operation, a traditional operation. But then once that's done, they're back at work day 3, day 4 after the procedure. No incisions, no scars. Patients are loving it. No one needs to know that anything's been done, really. Long-term success is, so this ESG or endoscopic sleeve gastroplasty works in 3 ways. It doesn't just reduce the volume of the stomach to make patients eat less. Also what it does is it increases their satiety hormones. There's certain hormones that the stomach produces to make the mind and the body feel like, well, hey, we've had enough. So this procedure actually induces increased secretion of those hormones to make patients feel like they need to eat less. It actually reduces the emptying of the stomach, so it slows down the emptying of the stomach, so food stays there for longer, so you do not need to eat as much because you do feel fuller, and you actually, if you overeat, you feel a bit nauseated. So you quickly learn how much you can eat and feel good. Well, it's one of the procedures that, the hairs on the back of your neck rise up because you can see that this obesity epidemic is truly an epidemic. We can see that by year 2025, we're going to see 80% of the Australian population either overweight or obese. So something needs to be done. If we're only getting 1% of these patients having surgery, we need to offer alternatives for the vast majority of these patients. Alternatives that are minimally invasive, safe, reversible, reproducible, and durable is exactly what we want to produce. And this ticks off all of those categories. So I'm very excited about the future of this procedure.